able to provide medical care for our patients from beginning to end.
We do consider ourselves here for the community, both for the birthing process through pediatrics, family practice, internal medicine, any sort of surgery needs, up until the end where we take care of folks in the nursing home.
Make them feel like they're welcomed from the time they're born until the end of life.
I think there's very few places to work in healthcare that have this flavor of a community hospital that cares about the folks that they serve.
You could have the Walmart mentality of how you deliver care in efficient large boxes, or you could continue to make the commitment in communities and in community services and trying to provide care locally.
It's important, and they like just coming in because you're here and they just enjoy it, and even though you're going to a doctor's office.
When you're in an accident or sick at home, you want to go to the closest place and be taken care of.
Yeah, cancer is everywhere these days, and we're fortunate to be able to offer oncology services here. It's much better for the patient if they can travel 15 minutes or 20 minutes to get their chemotherapy.
They're able to come here, be treated, and not have to go to the bigger places. You know, living in a rural area, it's hard to get places.
I had a gentleman yesterday whose mother was being seen in the emergency room. He's been trying to get her placement in a nursing home and trying to fill out all those forms. I just tried to help him find some of the insurance numbers that he needed. He just made the comment how nice it was to have someone familiar to kind of talk to kind of lean on.
I think we would all say we're literally taking care of our friends and neighbors.
In a community hospital, we know everybody. You know, we know it could be your mom, your dad, your sister, your brother.
The thing about Gifford is it really belongs to this community and vice versa.
One of the things that I spend a lot of time talking with both my primary care and my palliative care patients about, ironically, is how to stay out of the hospital. By providing some additional level of support, you can help people do that. I think about primary care as, if you're a patient, the first person you call when you have an issue.
Because everybody doesn't need to go to specialists, you need to have somebody that knows your medical history and can recommend the appropriate care.
Because you're not just walking into a stranger, you're walking into somebody who's known you for 10 years and can really spend that time helping you through those issues.
You're not curing diabetes and you're not curing high blood pressure. You're trying to manage those things so that people can live out their lives in a way that works for them.
Having a primary care doctor is actually a key determinant in your health as an individual.
To be able to provide that kind of person-centered care near their home, that's what primary care is about. A lot of times older folks with chronic medical issues, I think we think so much about the illness that we forget about the person and the family. It's very attractive as a provider to be able to spend the time that a person actually needs to deal with their chronic health issue. You're treating somebody with an illness within the framework of their family and their toolbox that they have to deal with that illness. There's just a real purity to it, like it's really about the patient and the family and what they need, who they have to support them, how that person is holding up. It's just really easy and fun to find a way to help.
Nursing home care is not easy. Takes a lot of time and effort. There's a lot of regulations. You know, sometimes when we talk about healthcare, we get very myopic and just think about a hospital or surgery or doctors, and it's beyond that. I mean, it's sort of community healthcare needs are much more expansive.
It's the only way to successfully age is to have people near each other and to be able to lean on a caregiver or a neighbor or a friend once in a rare while because it actually might keep you out of the hospital.
Palliative care works with patients who have serious illnesses, and the goal is to help with medical decision making, symptom management, and to kind of walk with people as their illness progresses. This is one of those areas of medicine that people are either really drawn to or think it's the scariest thing possible. I just find it to be a really powerful and kind of transformative period for a lot of people. To have one palliative care physician at a small hospital is sometimes considered unusual. That I think we have actually a team. I have a palliative care certified nurse that I work with. We have a music therapist. We have a volunteer chaplaincy program that sees patients in the hospital. I think Gifford is actually really unusual in this area. Besides the physical space, I think there's a way that people are taken care of when they're there that may be a little bit different in order to be there It's because we think you are at the end of your life. We have an amazing kind of depth of experience and a real team that can take care of patients at the end of life, as well as the space to do that. And I think that's really unusual for a hospital.
Anyone tell you today that they love you?
No.
I
You don't know, right?
I don't believe that.
Always enjoyed great relationships with volunteers, donors, the staff, and have always respected those relationships because I think they tie together to make us successful.
I was born in Washington, D.C., 1917. I've only been walking these halls for more than 40 years.
For him to wake up each morning to say, how can I make somebody's day a little bit brighter? Every day he just gives. He gets it back tenfold. Anytime we have people volunteering, whether it's the major or people sitting at the front desk, if somebody's going to give their time, that's one of the most valuable things that they have. They won't do that for an organization that they don't trust. Word of mouth in Vermont is actually quite effective. They'll ask their neighbors, they will find out and choose and figure it out.
Gifford provides a very unique setting for people who are wanting to have a natural birth.
In some circumstances, you want to invest the time and effort to say, I want to get really good care, I want to be in the right environment, as opposed to just going in for an episode of receiving medications or getting a procedure. The birthing process is a very special time, and so when they do their research or they do their homework or they ask around, they often find that Gifford provides a very unique opportunity and experience, and so they'll make that effort.
Surgery at this point in time has gone a long ways from one incredibly brave person with a knife. Now everything we do is technology-based. Every different service, orthopedics, ophthalmology, all require different equipment, all require different tools. When I first started, laparoscopic surgery was really fairly new to this area. Be able to operate inside a body cavity without having to make a huge incision is huge.
Just because you're small doesn't mean that you don't have skilled people here, which I think is sometimes an assumption that people make.
My day-to-day job is to basically ensure that I can do everything in my power to make sure the folks who are doing surgery have as smooth a day as possible. The right people, the right training, and just make sure that we get the best surgical outcome we can for our patients.
The instrumentation has become automated. If you're a patient that has a tumor in your breast, we can actually do an ultrasound-guided biopsy. Most of the instruments only take a few minutes to get results. So you get an answer and you have peace of mind. Before, we'd have to go to a larger institution.
We hope no one needs healthcare services, but when you do need them, it's important that they're there.
I truly love the fact that I'm taking care of my friends and neighbors. I work here by choice.
I've worked in a larger place where it didn't really matter that you had a life out of here.
I'm all about a community and a close-knit family. At larger institutions, you'll never see anyone besides your direct manager. Key bonus for me here is just being able to work hand in hand with pretty much everyone here and everybody knows your name.
Most of my staff have been there 10 years or more because it's a good place to work. We have providers that have been there for well over 20 years. Patients really like being able to come and know that their provider is stable and going to be there.
Gifford is perceived as a tremendous resource and that many of the communities are so proud to have us.
The emergency services, the birthing center, the assistance with the aged and the retirement community that's being built in Randolph Center are assets that once you become accustomed to them would create a lot of problems were they not available.
They really feel like we're a place they want to continue to see grow.
Gifford has a great deal of support in this community. But with that support comes a great deal of responsibility. I think that we owe it to this community to do things that are appropriate to the community and that the community needs and that the community supports. Critical Access Hospital has a great deal of ability to be very nimble with its decision making and react to an ever-changing healthcare landscape very quickly.
Trying to think about planning for the next 25 to 50 years for Gifford. One option was to start a new hospital from scratch and to build a brand new facility. We didn't want to feel like we would be gutting Randolph or sort of moving away from our historic roots, having been here 110 years. I guess in some regards felt like maybe building a mall or something. It just didn't sort of feel right. We could afford it, but we decided it's not our character. We've decided to take this opportunity and start an actual campus for seniors, as opposed to just building a building. We're setting in motion sort of a long-term strategic plan and vision that will get carried out for many decades, and it's exciting and it's great.
Out of studying that for 2 years, we came out with a model that we really did need to move into a new community for just our seniors, and then be able to use our present nursing home area that's attached to the hospital as our patient care area for our inpatient med-surg units.
I've never lived in a place that doesn't need a better model for growing old, and I think this idea of a place where you could live independently, and then when your needs increase, then you could still be in the same setting and get more help as you need more help. It's like the only way to do it.
One of the great benefits is it will allow us opportunity to grow in this site and add services that we may physically not have had room for.
It's not just an expansion of the hospital, it's looking at housing in general in the community to take a broader community view, which actually is something that Gifford has done for a very long time.
The experience that we're trying to provide a patient to help them heal becomes very difficult when you've got shared rooms, confidentiality, discussing procedures or problems, or issues managing wounds, dressing changes, toileting, hygiene. There are infection control issues. If patients are quite sick, their family members don't want to leave them. They want to spend a lot of time. There's nothing like looking over the hills of Vermont, all the woodland and some farms. It faces west, so you'll get a lot of beautiful sunsets. There'll be a lot of cameras. Nature is a gift, and it really helps to give us perspective and peace and calmness.
I have seen Gifford grow, and I have grown with it. God wants me to walk these halls, and as long as He puts me on my feet, I'm going to be in here.
There's a reason why patients who sometimes are at a bigger academic medical center, they want to come home to Gifford.